Hi, welcome to our session today. What we're going to look at is taking someone's peak expiratory flow rate and also delivering a medication salbutamol through a MDI and spacer. So the first thing we do when we come to an asthmatic patient is determine severity, and I'm going to use my paramedic decision making model, and I have decided that Don here is mild to moderate. So I would follow an action plan if Don had one available, but as he's explained to me, he hasn't got one yet. But Don does know his PEF or peak expiratory flow rate, so we're going to get him to do that. So this is a mild to moderate asthmatic. If they're severe or life-threatening, they won't be able to do their PEF. So what we're looking for is that the patient can blow above 70% of their usual PEF. So Don, do you know what your
520.
normal? 520. Okay, so we put this little button down to 0, and we ask Don to put his lips around the PEF, and then he's going to blow in a short, sharp burst as hard as he can. So could you blow into that machine short and sharp as hard as you can? Okay, so Don here has got 600, which is exceptional. We don't just do this once, we do take the best of 3. So once you've caught your breath again, if you could do that. And nearly at 600. So we're going to take 600 as our PEF today. So that means Don would be safe to leave at home if his symptoms resolved after treatment. The next thing we're going to do is administer salbutamol, either using the patient's own if it's not expired, or the ambulance MDI. So there's a way to do this, and it is going to take a bit of time, and we just need to talk our patient through this. So we're checking that this is clear, and whilst this chamber might not look clear, it's actually a shaded plastic. So we need to place the MDI into the end of the spacer, and the other thing we'll be doing is checking the expiry date of the medication. And so the expiry date here is 2028. We can just check that with the patient. You're happy that it expires 2028? Yeah. Okay, so then we're just going to coach the patient through this. They may have used a spacer before, but what we're going to do, Don, is I want you to just breathe in and out normally 6 times with your lips wrapped around here. So I can pre-prime this without actually having it in the patient's mouth. So it's 1 squirt, and can you just breathe in and out 6 normal breaths? Just nice and slow. 6, fantastic. We're going to shake it again, and another 6 breaths. Okay, we're going to do this 6 times at a minimum and up to 12 times, and the dose can be repeated. So 6 to 12 times is the dose for an MDI using a spacer and our guidelines, and it's important that we give the full amount of medication. Thank you, Don.